Wonderful. Okay, it's 5:32. I want to call the meeting to order and ask for a roll call, please.
Yes. All right. Helen Burks.
Here.
Here.
Marisol Cantu. Okay, absent.
She actually sent a message to myself and to Misha to say that she wasn't well, that she would try to be on, but that she wasn't actually sure if she would make it. I will forward that email to you, Guadalupe.
Cool. Thank you. And I guess for the future, if they can also CC stuff so we can keep note of that.
I know. I keep telling people that, but I will forward it on.
Thank you. All right. Eddie Chacon.
Here.
Luis Chacon.
Present.
Juan Gosney.
Here.
Randy Joseph. I do see he's here, but I'm not sure if I heard you.
I'm here.
Kristen Killian Lobos. Not sure if I heard
I'm
you.
here, sorry, I'm here.
Armand Lee. I don't believe he's here. Okay, absent. Laura Mingles. All right, absent as well. Marcus Engesang.
Here.
Joy Schlemmer.
Here.
Deborah Small.
Present.
Ben Terrio. It is absent. Tamisha Walker.
Present, Happy New Year.
Happy New Year. Linda Whitmore. That is absent. And BK Williams.
Here.
All right, that presents a quorum with.
And I just saw Marisol just joined us.
Oh, okay, so let me mark her as present then. That leaves us with a total of 13 task force members present and 4 absent.
Okay, wonderful. Thank you so much. So have people had a chance to review the agenda? Does anyone have any suggested changes they'd like to make before we adopt the agenda?
No.
Hearing no objections, and I'll say the agenda is adopted. So the next item is a review of the meeting procedures.
All right. Anyone may make an oral comment, even if a written comment has been previously submitted. However, each speaker may raise their hand once to make one oral public comment per agenda item. We will hold public comment very shortly after item F, city staff liaison reports. So if you would like to speak during public comment, please raise your hand now. To comment by video conference, click on the participants button at the bottom of your screen and select the raise your hand button. To comment by phone, you will be prompted to raise your hand by pressing *9. For agenda items under item H, presentations, discussions, and action items, you may use the raise my hand feature to express your interest in providing public comment for each agenda item. An announcement will be made when it is time for public comment.
Thank you, Guadalupe. So the next item is approving the minutes from the November 30th regular meeting of the task force. Does anyone have any comments or suggested revisions? Joey, I see your hand.
Yeah, I just wanted to thank staff for doing an excellent job on the meeting minutes, and I'll make a motion to approve.
Second.
I agree. They did a really great job on it. It was very detailed and you really got the flavor of every conversation. So I too want to add to Joey with that. Does anyone have any additional comments? I think I heard a motion. Was there a second?
Yes, I seconded Steve.
Okay, great. So we have a motion to approve the minutes. Is there any discussion of the motion? Hearing none, then can we just take a vote, please?
All right. Helen Burks.
Aye.
Steve Bischoff.
Aye.
Marisol Cantu.
Aye.
Patty Chacon,
Aye.
Ms. Chacon,
Yes.
Ron Gosney,
Yes.
Randy Joseph,
Yes.
Kristen Killian Lobos. I'm not sure if
Yeah, yes.
Marcus Ingesing,
Yes.
Gary Slimmer,
Aye.
Deborah Small,
Yes.
Keisha Walker,
Aye.
and BK Williams.
Yes.
So the motion passes with 13 ayes and 4 task force members absent.
Wonderful. Thank you so much, Guadalupe. Okay, so the next item is city staff reports.
I don't have a report unless Allison, Lupe, or Stephanie have something to add. But I just want to say Happy New Year. We're happy to be back supporting all of you. And I know 2023 is going to be a great year. We're going to get a lot of work done. And considering we have a lot of items on the agenda and a lot of information to share, that's it for tonight for me. Thank you.
Well, I just take this as a good sign that we're sort of off and running so efficiently. And I too wanted to start the meeting by extending New Year's greetings to everyone. New year, new opportunities to really move the task force forward. I'm really excited at some of the things we talked about at our last meeting in terms of hosting community forums and moving forward on the programs that were already approved and thinking about other ways that we can make life even better for Richmond residents. So I too am looking forward to this year as a year of renewed opportunities. And I really want to thank everybody for their continued commitment to this process. I know it sometimes has felt long and tedious, and it's been, I think, in many ways, maybe more of a commitment than what people intended. But I just really think the work that we're doing is important. And whenever I talk to my neighbors about it, they tell me all the time how happy they are about the ways in which the task force is supporting the homeless and employing our youth and reducing gun violence. So I just think that it's important to know that people see us and they appreciate what we're doing. And I appreciate each of you. And with that, I'll shut up and let us go to the first item on our agenda.
Chair Small, I do believe we have to go to public comment first.
You are correct. I apologize. This is what happens when I get too excited about doing the work. Yes, you're right. It's public comment time. I too will shut up and make way for that.
If we have anyone who would like to make public comment, this is your time. So please raise your hand, use the raise hand feature at the bottom of your screen, or press *9. I do not see any hands. So with that, we will move to the next agenda item. Thank you.
Great. Well, the first agenda item is to discuss and approve future community forums on traffic safety, harm reduction and overdose prevention, police policies and practices, youth employment and training, and poverty reduction. These are the topics that we talked about at previous task force meetings. And the idea was to organize forums, community forums, similar to the ones that we did in developing the proposals, and sort of provide both information to the community and get some input from them about what they think we should be doing around these particular issues. So let's discuss. Don, I see your hand.
Thank you. When we discuss traffic safety issues, I'd like to make sure that we include traffic studies on this. We've had several times in the city council meetings the past 4 months that has been brought up where they more than $750,000 allocated for specific traffic calming and safety issues. And it comes across as being very political in that almost all the money was from one particular district where 2 council members live, and there were no traffic studies involved to determine whether there was actually a need for it, other than the fact that it was being directed by council members. And at the city council meeting last week, 2 of the new council members wanted to make sure that their districts got their fair share. They referred to it as equity. I think it just needs to be discussed whether these kinds of issues should be looked at on a citywide basis or by an electoral district issue, because it does make a difference on these things. You go ahead.
No, I'm sorry. I did not mean to interrupt.
I'm through now. Go ahead.
The only thing I wanted to say is that all of our community forums have addressed issues on a citywide basis. We've always tried to make sure that whether we were talking about reducing gun violence or providing services for our unsheltered, or, in supporting young people, that we look at Richmond as a whole. And I don't think that the intention is any different with respect to any of these issues here, including traffic safety, which is a citywide issue. And the goal is to get input from residents around what do they see as the priorities with respect to traffic safety in their community. So that the same way that we developed other proposals that were responsive to community needs, we would do the same around this issue. And Vandy, I see your hand.
Yeah, and putting in specifically traffic safety, I wanted to make sure that we highlighted a way to talk about DUIs, because I know there's a lot of grants and money that goes into DUIs. And being a police commissioner, I've been on 2 checkpoints to see how those things works. But if you look at statistics in the city of Richmond, that we still are we're the highest DUI. They have the highest DUI rates in the county, and some of the prevention that been already started has not really worked to curb those numbers. So I would like to see a section or maybe time set aside to see if community had ideas on how to reduce DUIs in the city.
So one thing I just want to say for clarification, just as with the other forums that we put together, we tried to include the people who were stakeholders. I listened to Chief French's report to City Council last night that talked about issues related to public safety. And it was my intention to ask her if she would participate in whatever community forum that we organize around this issue, so that she would be able to include the data that the police department has around traffic safety issues, which include issues related both to DUIs and accidents, et cetera, as well as getting input from other city stakeholders around this particular public safety issue. Did you have something else you wanted to add, Randy?
That's okay. I'll follow up with Sergeant Deaches with that, because I know he does the UI stuff, and I'll reach out to him to see if he can get permission to show, because he has a lot of information on that. And I've talked to him in the past like 4 or 5 times about the police and the statistics. And that's where I usually get my statistics from. So
yeah. From the city council, the newest council member, Doria Robinson, expressed a particular interest in this issue. So I was going to ask her if she would be our city council host, since it's also been our practice at these various forums to have a representative from city council to be there too, to also get the input that we're getting from the community. I see your hand is up, BK.
Thank you, Chair. Speaking of new council member Robinson, I wanna just kind of throw this out there. Maybe it's off, but or to some of you, but to me it's not. I want to consider with traffic safety, public art. And that's one of the things that Daria is also the new liaison for the Arts Commission. And I just want to suggest that, maybe working with the public arts folks and making sure that intersections and, you know, those things that may affect our the visibility of traffic crosswalks and all of that are beautified. And I think by working with another department like that, we're not isolating this as simply traffic safety, but we're also integrating it into the network of our community and our city and the things that make our city a comfortable and a place for our residents to thrive. So I just want to maybe suggest that we conflate those two and keep the aesthetics in mind as we're looking at traffic safety. Thank you.
Thank you so much, BK. I couldn't agree with you more about that. Don, I see your hand is up, but I also see Luis, and he hasn't spoken yet. So do you mind if I go to him first and then come back to you?
No, you go ahead and push everybody ahead of me, and just maybe sometime before the end of the meeting.
Never mind. You know, if you're going to be that way, petulant, please go ahead right now.
Sorry, I wanted to follow up on what you were saying about the traffic safety after I tried to talk earlier, in that I want to make sure that there's a specific component in the discussion about the traffic safety reviews and the district issues. You've got 5 out of the 7 city council members that have made it a district specific issue. And that is not equity for the entire city. As I believe it needs to be addressed. Not just assuming that we're going to be talking about the entire city, but specifically talk about the fact that you've got city council members, like I said, 5 out of the 7 have directed that their districts be taken care of. And that doesn't always work. Thank you.
Luis, please go ahead.
Yeah, as I'm hearing different folks talk, and especially as I hear Don mention a few of his concerns regarding how decisions are made in the city, I'm wondering if maybe another community forum is also needed, where the community discusses just how these decisions are made, right? Maybe to demystify city council and city government and talk through these issues, right? If folks feel like maybe the decision-making process isn't fair or isn't clear, I think that's a community issue, right? And that's something that needs to be discussed. So just wanted to put that out there. My original comment was more regarding outreach for these community forums and just really imploring us to reach out in areas that we might not, or that the city might not normally reach out to, just to get strong representation of different communities. And we can have a conversation about that, but the first ones that come to mind are like the faith communities, right? Especially like for the Latino community. I think that's a big just area where we can get folks to come to these forums, and also maybe reaching out to schools just to get youth representation at these forums. And I'm complete.
Thank you, Luis. I agree with you about that around outreach. And once we set dates, we can begin developing our outreach plan around how we're going to, get as many people involved as possible, or at least notified. So I appreciate you reminding us about that, though. And Helen, I see your hand is next. Go ahead.
Yeah, I'm really just kind of checking in on what our outcome is that we want for this item on the agenda, because I'm just looking at the full agenda and I know it's packed. Are we wanting to just decide on the topics, or are we going as far as scheduling in our meeting today?
I was hoping that that we would both approve the topics that we had discussed previously and then begin to schedule. My recommendation was going to be that we follow a similar format and scheduling that we have done in the past, which is to have those community forums on the 3rd Wednesday of the month, which would be a week before when we have our task force meetings, which is the 4th Wednesday of the month. And that we could begin to say which one we're going to have in February, March, April, and May, if we agree on these topics. That was my goal.
Great. Then I guess my statement will be that I believe these topics look good to me. The only thing I might include with the youth employment one is just saying youth employment and safety, because I think there's some youth safety concerns that deserve some time in that moment. And that I want to encourage us, if we're just setting on the topics, not to get too in the weeds with the specific content of a single one, because I think that'll really happen as they're being planned. So that's my comment.
Thank you, Helen. And I'm open to modifying that topic to youth employment and safety if everyone else is agreeable to that. Tamisha, I see your hand is up.
Thank you for recognizing me, Chair Small. I wanted to raise up that we have a lot of new elected leaders in Antioch who seem excited. In Richmond, who seem excited to roll up their sleeves and get in the community and actually hear from people. And I understand what Don is saying, because it could be a little frustrating to have leaders who are supposed to be thinking about the whole city, but only think about where they live. And so I'm wondering, as we move forward with our community engagement process, if this group was amenable to making sure that district representatives are involved and, engaging their communities, their districts, and getting residents to these conversations, and that they should also be involved themselves. Because for the most part, I haven't seen a lot of them involved in this process, even before the elections. And so just wanted to point that out.
So thank you so much for that, Tamisha. And can I be bold enough to ask if you'd volunteer to maybe help work on planning this particular forum, community forum?
Yes.
Great, thank you. Joey, I see your hand is up.
Yeah, I wanted to agree with a lot of the comments that Louise said about educating the public and demystifying some of the governmental process. But quite honestly, I would say that's really on the onus of the city council to maybe have some of their own community forums as far as that goes. But it's a good year. It's a good idea nonetheless. The other thing I will say, as far as traffic safety goes, is there's a lot of statistical data that's out there. Some of it is collected by the state of California based on collisions and stuff that can identify areas. You can make it small or make it large to kind of identify what areas are prone to collisions for one way or the other, and that might be able to drive some of the locations, and it does drive some of the locations that are given a little extra attention by the police department.
So thank you, Joey. I just want to note that we've had a lot of discussion about the traffic safety forum, but we also are approving having community forums on harm reduction and overdose prevention, police policies and practices, youth employment and safety, and poverty reduction. And I don't want us to spend that much more time on this item because we do have a number of reports to get tonight. So I want to find out if anyone has any comments to make about those other forums that we haven't discussed yet. Don, is your comment related to one of those?
Well, it's a question about what your intent is, whether you plan to have one forum involving all 6 of these items or 6 separate forums.
No, I think I explained that we were going to follow the format that we did last year, where we had a community forum around a particular issue, one a month on the 3rd Wednesday of the month, which was the week before our regular task force meeting. Randy.
Yeah, I like, I think it was Helen's suggestion about making the youth employment training and safety. I would want to maybe more talk about to maybe change the title of poverty reduction to something more to like make people understand what we're trying to do in that? Because I'm still kind of confused what you mean by poverty reduction. Are we talking about getting people into employment, raising minimum wage? Like what are you exactly talking about? So maybe get more of a focus on that one. But I like all the
So,
rest of them. So if I
I
get
thought about the title of Reduce Poverty Enrichment, RPR, with the idea that we can't necessarily end poverty, but we can reduce poverty. And what are some of the initiatives that local communities are looking at that help reduce poverty? They could be anything from establishing minimum income, for a particular group of people, or providing certain types of housing assistance or other things. So it's really thinking about, because part of our conversation around the task force was getting at some of the root causes of the social issues that we're addressing. And many people have identified poverty as one of those root causes. So the idea of what are the things that we could begin to recommend that we can do as a city that will help reduce the level of poverty that begins to address the root causes that thereby generate increased levels of homelessness, drug addiction, etc.
Okay, that makes sense. Maybe, and I like your acronym, maybe for me, so that other people can understand, maybe just like poverty reduction strategies or something like that, but other than that, I'm for that.
Yeah, I'm not attached to the name. We can change that. I just want us really to agree on the topic so that we can begin the planning process and be able to move forward.
Okay, if anybody don't have any other questions, I'd like to move forward to approve these specific community forums for future community forums.
Chair Small, you should take public comment first before you move on to any motions.
Thank you so much, Allison. I swear I don't know what I would do without you guys here to keep me on track. So can you, Guadalupe or LaShonda, can you guys go for public comment? Thank you so much.
Yes, thank you. So if anyone has public comment on this agenda item regarding community forums on the topics discussed, please raise your hand using the raise hand feature at the bottom of your screen, or by pressing *9, and you will have 2 minutes each. I do not see any hands raised, so we do not have any public speakers for this item.
Does that mean I can move forward and call for a vote on the motion, Allison? Okay, thank you. So can we take a vote on the motion?
Was there a second? I just want to make sure that was clear.
Oh, I thought I heard a second. I'm sorry. Let me go back. Randy, you made the motion. Is there a second to Randy's motion that we approve the topics that we discussed for future community forums?
Yeah,
I'll second.
Yeah, I want to make the motion clear, just with the change with the youth employment, training and safety and poverty reduction strategies. That's it.
I'll second.
Okay.
Can you clarify again what was in youth?
Yes, so my motion is to approve the future community forums on with that are written up there with the changing of the title of one of them from youth employment and training to youth employment, training and safety, and poverty reduction to poverty reduction strategies.
Thank you. I will go ahead and do roll call. Helen Burks,
Yes.
Steve Bischoff,
Yes.
Marisol Cantu, Marisol Cantu. Not sure if she's there right now. I'll get back to her. Eddie Chacon,
Yes.
Luis Chacon,
Yes.
Gosney,
Yes.
Randy Joseph,
Yes.
Kristen Killian Lobos,
Yes.
Armand Lee,
Yes.
Marcus Ingesing,
Yes.
Joey Schlemmer,
Aye.
Deborah Small,
Yes.
Tamisha Walker,
Aye.
BK Williams,
Yes.
then I'll circle back to Marisol Cantu.
Yes, can you hear me?
Yes,
Okay, sorry about that.
so the motion passes with 14 ayes and 3 absent.
Great, thank you, everybody. So, and then I guess, hopefully, is there any reason, let me see, that I would propose that we plan to have the first community forum in February, which, although that's a short month, so that doesn't give us a lot of time to plan. So maybe, let's say we start in the first one in March. We have March, April, May, and June, because we're doing 1, 2, 3, we're doing 5. So March, April, May, June, and July. Does that work to people?
Works for me.
So at our next meeting, we'll put together the group to plan the March meeting, and actually who's going to plan the next 2 meetings so that they can begin working on that and getting the information out, figuring who needs to be invited for the panel, etc. And again, my recommendation is that we follow a similar format to the ones that we used before. And Tamisha, I see your hand. Go ahead.
Yeah, I would push past March for the first one. Just, I mean, I don't know about everybody else, but most of our, some of us are getting back to work. Organizations are going through strategic planning and a lot of things. And so if March is going to be it, and I know I just committed to help support these forums, that is there gonna, is the subcommittee to create the forums going to be meeting once a week leading up to the first one? I'm just trying to get a good gauge of my time, how, the time that it's gonna take to do outreach, get the community out, get the agenda, get the word out, all of that stuff.
So first of all, we don't have to do them in that order, just because we agreed on those topics. So the first one doesn't have to be traffic safety. It could be something else. But I do think that the sooner we could get started, the better. I actually was going to volunteer to organize the one around harm reduction and overdose prevention, which I could probably do by March. And we could start with that and then go on from there. But I would like us to begin, and I would like us to do it on a regular basis so people associate us with that. Plus, we can have them announced at the city council meeting when we do our report to the council, which is at their second meeting of the month, which would be a week before our community forum.
Sounds good, Chair.
Okay, any other comments before we move on to the urban strategies presentation? Not hearing any, then I really want to invite David Harris and his colleague here to present to us tonight from Urban Strategies. They're working on the proposal for the Community Crisis Response Program. And I'm going to turn it over. LaShonda, is there anything that I need forgetting to say before they start?
No, I just have, I want to thank David and Ann also for joining. They were up with me late last night till 11:30 p.m. waiting to present to City Council, but did not happen last night. So I just want to thank them for that. I'm tired. I don't know about them. And if Stephanie, if you could bring up the slide deck, we would greatly appreciate it. I just wanted to intro, and then I will turn it quickly over to Ann and David. Thank you. So you all we've been talking about community crisis response for a while. The task force has envisioned this and brought it forward to City Council. And we are here to provide an update on the work that Urban Strategies Council has done so far. Next slide. So the task force was created in June of 2020, and the task force subcommittee that was working on the item came up with the idea to implement something similar to the Cahoots program in Oregon and Macro in Oakland and other programs within the city of Richmond. That proposal was brought forth to City Council, and in July of 2021, City Council allocated funding to help with the development and implementation of that program. Here are a few bullet points on the program's focus. Really, it's a non-law enforcement community response. It's an alternative response model, and really is to support community that are experiencing or in need of additional support and services. And a lot of the work that Urban Strategies is doing really is about hearing from community, honoring the work that has already been done to date, and bringing forth additional information and recommendations to City Council about what implementation looks like. Next slide, please. So in the contract, so we do have a web page, and there's a link to it on the next slide, I believe, but there is a web page where we attach the contract for Urban Strategies Council. We want to be extremely transparent. This was approved by City Council and a few months back, and there are 5 tasks within that contract. And so we've already, task 1 and 2, which are outlined here, are ongoing. We have provided a number of documents to Urban Strategies Council, documentation that are documents, information that the task force has generated. They are looking at case studies. They're doing a bunch of work. We're sharing other needs assessments and strategic plans and survey results with them so that they have a lot of information to start the work. And then right now we're in community engagement, and community engagement takes time because we want to do community engagement right and make sure we're hearing from as many people as possible. And I know they're going to go into a little more detail, but here are some items within the community engagement task. Next slide. So what they will do after they conclude the community engagement process really is tasks 3 and 4. So, and they will be combined and part of the report that goes to City Council in late April or May of 2023. And that will be analysis of the different program options. So we are clear, Council gave direction to implement a program. What that program looks like, exactly is it an in-house program in terms of being a City of Richmond department? Are we partnering with a nonprofit organization that can help implement this program? How are we working with the county? So they're getting into some of those specifics in their report. And it will also include the proposed program plan. And there are a lot of different components that they will be considering and looking into as they present information to City Council. And then based on that report, City Council will decide on what implementation looks like, what option they want to go with. And we have, as part of the contract with Urban Strategies Council, we made sure that they could help us with implementation. Next slide. So here's just a brief timeline. There's more dates on the website, but this just gives you a sense of where things started. And so, you know, when we share this slide deck, we'll make sure you all can take a look at it. Once again, look at the website to understand that funding was provided about 1.5 years ago, July of 2021. And this initial program was actually housed in the fire department. The funding was in fire. The interim fire chief before Chief Montoya was actually working on this program and leading. I was supporting, and then with the transfer, there was a transfer of the program, I really kind of feel unofficially to me to push it forward. And I'm continuing, of course, to connect with fire and PD and other departments in this work. And that happened about 1 year ago in January of 2022. And soon after, we worked really closely with the subcommittee to create an RFP that, like I said, we work collaboratively with members of the task force subcommittee to do some extra exploration of what community crisis response could look like. I think the idea or the hope was maybe city staff could do some of this work on their own and bring something to city council, recognize we don't have the expertise or capacity to be able to do that. And so work with task force subcommittee to create an RFP. And that's how we got Urban Strategies Council. They were approved in July, and they have been working since sometime in August on the task that I shared with you. And the next time they were trying to go to council last night, though they're back on the agenda for February 7th to provide council with an update. And then the hope is that they will have a report to city council to talk about next steps and more specific strategies around implementation in May, late April, May of 2023. And there's the website. Next slide. And this just is a representation visually of the timeline for some of the other city departments that were created based on concept and desire by community. And so we focused on ONS and the Richmond Fund for Children and Youth, just to give a sense of, I know there's been some frustration about how long it's taken for Community Crisis Response Fund to be, programs to be implemented. And so we're just trying to show that development of programs take time. ONS, from the concept of youth was a public health concern and an issue that we needed to address, was in 2005. And it took years before staffing was actually hired to implement the program. And the same thing with the Richmond Fund for Children and Youth. The measure was passed in 2018, but it took till 2020 for staff to get on board and the application and grant program to be developed. So things do take time, and I just wanted to highlight that. But we understand the need, we understand the urgency to implement this, and staff definitely is doing its best and working collaboratively with Urban Strategies Council to get this work done. Next slide. So with that, I'm going to turn it over to David Harris and Ann Jenks with Urban Strategies Council to get into some of the details. Thank you.
Thank you, LaShonda and Guadalupe, for your support and introduction. I'm not going to go through all of the activities that we've done to date. I think the most important thing for tonight is that we get your counsel and feedback. We, as LaShonda mentioned, began our contract back in August. We began with our interviews of elected leaders, as we've done in other cities. We've done this work in Oakland and Antioch and in Cambridge, Massachusetts. We were a little delayed and sidetracked by the election season that came up. But nonetheless, we've been able to have meetings with a number of stakeholders, and we're actually now poised to begin an even deeper level of community engagement and also design of the program. And you could stop sharing the slide so I could see everybody. We've just to give you a sense of who we've met with to date. Excuse me. I'll come back to that. But our plan is to convene several community focus groups and community-wide meetings. We also have a survey, community-wide survey we've developed that will be administered in February. We have two goals for tonight's discussion. One, we'd like to identify a working group of the task force members who we could meet with to advise us on the implementation of the remaining engagement strategies. We've spoken with Ms. Cantu and some other members, and we've heard loud and clear the desire for the task force to be actively engaged in our work. And given your previous conversation about engagement, we want to make sure that some of the concerns you have as it relates to previous or ongoing efforts are not, those concerns are not replicated through the work that we do. Secondly, we'd like to ask you to either the working group or the whole task force to take a look at the survey we've developed, give your feedback by next week so that we're ready to hit the community and do the survey. And third, we would like your thoughts about groups that we need to make sure we do not pass up and connecting with. Those groups need to represent both the allies and supporters of the initiative whose voices are rarely heard in these processes, but also people who you think may be opposed, that we need to do some form of outreach and education with to build their support. Our plan is to provide a definite recommendation to the city in late April, early May of different options that the city needs to act on to implement this program. And with those options, we'll also give a timetable because as we've learned from other communities, different options have different timetables. But our what we understand is our mandate is to present options so it doesn't equal 3 to 4 years to implement like some of the previous initiatives. And so we defer to your wisdom and your guidance on how we can make this process both engaging, beneficial to the residents in response to the needs that you as the task force have and representing the residents of the city. So I'll stop there. I'm got my papers mixed up. And do you have a list of the groups that we've met with already? Do you want to share those?
And while Ann, really quickly, thank you,
I've got
David.
too many papers.
While Ann is getting that, I just want to share two things. One is Stephanie just sent the slide deck to all of you. It wasn't ready at the time that we published the agenda, so it will be on the website, and she just sent it to you all in your email so you can see, because there were some additional slides there. And then also there is a working group that has already been established at your last task force meeting. It involves 4 members of the task force, and we have recently been in contact with the 4 of you that wanted to serve on this task force to schedule a meeting with David and Ann. And we also will be asking for that task force working group to look at the survey because we don't want to violate any Brown Act issues. So David, we have, I think the individuals are on this call that are part of that group, and they're very excited, I know, to move this work forward.
Thank you. You know, I'm not as well versed in city policies
It's all good.
as you are.
Ann was working on it. That was our fault. I don't think we put you on a lot of those emails. So my apologies for that, David.
No, thank you. And I look forward to our meeting. So here are the groups that we've met with in addition to the task force: the healthcare for homeless, Matrix, which we're still like you waiting for their report, Just Cities, HIV Education and Prevention Project, EPAC, Brighter Beginnings, Family Justice Center, Richmond Public Library, Office of Neighborhood Safety, Office of Healthcare for the Homeless, the Public Defender's Office, Asian Pacific Islanders Coalition, Nepali Health Advocates, and there might be 1 or 2 others. But we very much need your, we reached out to a couple of the Latino organizations that we're still awaiting to hear from, and we'd like both to get more access to those groups. We have relationships in the Black community, specifically with the faith-based community. And we'd also like your guidance for how we can connect with more young people, particularly the schools. And I think Mr. Chacon, you brought up about the schools in a previous discussion we had. So that's where we need your help. We need your thoughts about what worked and didn't work and some of the focus groups and community meetings you've seen. And we'll get a lot of that with meeting with the 4 members, but this is an opportunity to get it from all of you.
Just to add a little bit to the list, there's several people in this meeting that we've talked to. There's a couple more that we've tried to reach out to, and please, if you have the time, holler at us, and we would like to very much talk to you. Everybody is talking about you, Luis, because he also mentioned some of the Latino churches. We'd really like to get in there. We do have some relationships in the among Black clergy, but I bet there's others that we don't know. So I don't want to suggest that we just need help in the Latino community. Any meetings that are coming up that we can get on the agenda for 15 minutes would be fabulous. Or, you know, if it's a community event and we can just come and have a table, that would be great too, because we will have the survey soon. I wanted to ask specifically about how we should be distributing the survey. Do we just, LaShonda, send it to the task force list, or?
You mean for input?
Yes.
So, I mean, to me right now, because there was a group that was designated to focus on this.
Okay.
I would have, I'm gonna ask Stephanie or Lupe tomorrow morning or tonight to send the survey to those members with the deadline, so that we want to continue to move this work forward, but it'll be the working group that will continue to work on this.
All right.
Item.
And
we
then
can always present back to the full group.
Okay, great. And then a lot of the other meetings have been with various county elements. In terms of understanding, one of the things that we have heard a lot, and I think it's definitely something to focus on, is kind of how does what the city is doing add to whatever you're getting from the county without duplicating it, and, you know, kind of fill in what's not happening. So there have been a lot of conversations with the county and with a lot of folks in the city, in the fire department, now with the police department, along with some of the other folks that David mentioned.
And we've finally been able to get on the schedules of the new and the former council members that we didn't get to. The only council members that agreed to meet with us before the election were Councilmember Jimenez and McLaughlin. There were, in full disclosure, a couple who did not want to meet with us before the election.
But I will say, I think all the new council members have been engaging and are very much interested. So we're excited about the opportunity to continue to engage and with elected officials, county, community-based organizations, faith-based organizations. So any feedback, all of you have input, even if it's not just for tonight, but if you have additional ideas, please send them through your staff. So myself, Lupe, or your chair, or Stephanie, and we can make sure we get those to Ann and David. You may wake up in the middle of the night and be like, oh my gosh, yes, this organization, they need to connect with them. Feel free to email us at that time. So thank you, Chair Small. I think we are done with our presentation as well as our ask of the group, and are available to answer any questions or take feedback. Thank you. You're muted.
Yes, my computer just informed me. I'm sorry. If any task force members have any questions they'd like to ask of David or Ann or LaShonda with respect to the proposal or the work that they're doing, please raise your hand now and we'll take task force member questions first and then we'll go to public comment. I don't see any hands raised. Oh, okay, Joey, I see your hand.
Yeah, can David or Ann maybe sum up what their goal is and, you know, like in a sentence or two? I'm a little lost. I mean, I kind of get the gist of everything going on, but I'm not quite sure what the end goal is.
Sure. There's tonight's goal, but you want to know the end goal of the project, correct?
Yes.
The end goal is to present to the city council a program, design and plan for an alternative non-police response to 911 low-level nonviolent calls that the city council will be able to adopt and implement for the city of Richmond. And we will present different options based on our work doing this both regionally and nationally. And we will give the policymakers different options to consider. And those options will be tailored to Richmond based on the feedback and aspirations and needs of the residents of Richmond.
And has your project been implemented in another jurisdiction?
We've designed programs in Oakland, Antioch, and Cambridge, Massachusetts. And in all three places, their governance structures, city councils have approved funding for programs. In Oakland, they approved funding for the macro program, Mobile Assistance Community Responders of Oakland, which has been allocated initially $1.2 million. And it has been placed inside the Oakland Fire Department for implementation. Employees have been hired. Teams have been deployed. In Cambridge, Massachusetts, the HEART program, which I don't remember what that acronym stands for, has been funded by the city council and implemented, and is being implemented by a nonprofit organization in partnership with the city. And in Antioch, the program that we designed was accepted and is the city council approved it, allocated funding, and decided that they wanted a nonprofit organization vendor to implement the program, which is currently in the startup phase of implementing the program. We are also working as part of an international association of alternative response programs that are monitoring and looking at these programs being implemented, not just in the United States, but also in Canada and other parts of the world.
So the two that you mentioned, Oakland and Cambridge, those two cities have a system up and currently running and operating. Is that correct?
Yes.
Okay, thank you.
Steve Bischoff, I see your hand.
Right. Yeah, I wanted to sort of try and figure out the context of this in a way. I mean, I spent a lot of time studying the macro program, which looks very good. But one of the things I noticed too is that that program got an allocation of $10 million from the state, which seemed to be kind of handy for this whole thing. But, in terms of how much we think we're going to spend and how we're going to interact with the county program, the A3 program, because I think we need to have a very clear idea of what they're doing, what they intend to be doing as we try to design our own. So
we've been working with the county behavioral and public health services, Dr. Tavano's office, since we began our work in Antioch. And we have some meetings upcoming scheduled with them along with city staff to get updated on where they are. I'm sorry to say, but that's a multi-year. That's another one of these things that's taken several years, and all I could say is that in terms of macro, yeah, they were able to get the $10 million from the state. The city put in their money, but there's still implementation issues that we're learning from it. Fundamentally, we believe these programs have to be built on the assets that exist already in our communities. And the main asset are the people, those who have lived experience, those who know the folks in the community that they may have to be dealing with, and the relationships. When you deal with city bureaucracy, you have to be ready to deal with all these civil service requirements and things like that, which I understand, but which may be at some points barriers to people who might not necessarily be able to get these jobs. So in Oakland, what we've learned is how we have to really try to, on the municipal side, both address the barriers to entry for those the workforce that needs to do this work, as well as the barriers to entry for people who want to get these jobs, which is a workforce development issue. I know that when we worked in Antioch, we got exposed to the Spirit program, for example, which I know Ms. Killian Lobos is working with, and has done some work to prepare people for these jobs. But make no mistake, there's a national shortage of credentialized people for these jobs. So when it comes to talking about looking for licensed social workers and things like that, who may not even be the people who want these kind of jobs, we have to rely, as I said, on the assets that exist in communities. There are different lessons from different experiences, whether it's located in the city, whether the city outsources it to a nonprofit. However, you have to start with what exists in the city that you're working with, in this case, Richmond, and what are the specific needs and desires that Richmond residents want from this that may be different than some other place, even the whole CAHOOTS program in Eugene, Oregon. Eugene is not Richmond.
that's true. And Richmond's not Oakland either, because one of the things about Oakland is there's a lot of defined services in Alameda County, a number of which are based in Oakland, that work in this area. So it's not, we don't have the same thing here. We're going to have to really sort of think about how that's going to work out. And that's why the county program is so important to us, because, that's going to be our other real resource. In Oakland, there are other places you can turn, but not here.
Mm-hmm. Yeah, thank you, Mr. Bishop. Oakland can be viewed by many as resource rich, And in Antioch, we would define that as very resource poor. And so maybe Richmond does fall somewhere in the middle of that, but you've got to look at this will only work with a strong network of referral organizations and support organizations. Because remember, this is a response program. It's when someone is out there, whether they're, a sleeper in a car, urinating in public, whatever. It's about responding to the situation so that no one with a badge and a gun has to show up to that situation. But they're not there to solve the situation. That's why we need a network of resources, and we need to find out what the county's going to provide to be able to do that, or what already exists in Richmond or elsewhere that can meet the needs of those people who are in the middle of an incident.
Yeah, that's part of what I'm kind of hoping that we're going to be able to spell out. Before we take something to the council, even I think it'd be kind of good if we could sort of spell out what those resources might be.
We will.
Otherwise, we come up with something and it by itself is not going to work anyway. So,
well, I think it's a good idea that you're on the working group that's going to be working with Urban Strategies on this, Steve.
Cool.
Yes, you.
Yeah.
Okay. Helen, I see your hand. Was someone about to say something? Did I interrupt you, Lasanda?
Ann.
No, it was just me.
Ann, I'm sorry. Go ahead.
What Macro finds is that over 90% of the interactions that they have do not use a referral. So yes, referrals are important. And I don't mean to minimize that at all, but the majority of times the team is out there addressing a crisis and they're just addressing the crisis, right? Without doing any kind of a referral. The other thing that I just wanted to mention in terms of the county is that where the county is right now and where the county may be in 5 or 10 years is going to be substantially different. And I'm very hopeful that they're able to kind of grow themselves. What I think the real answer for Richmond is to be nimble in their program, so that if suddenly the county substantially expands and can respond to some of the calls that the Richmond team has been responding to, studies are pretty universal in saying somewhere between 30 and 40% of the calls that are received by 911 or a non-emergency line on average, and we're going to go with that since we don't have the matrix analysis yet, don't really require a police or fire response. So there's, it's fish in a barrel situation. There's not going to be a situation if it's designed correctly where there's overlapping of services and other things that are being missed as a result of trying to do the same thing the county's going to do. If Richmond can be nimble, there's plenty of work out there. And if the county is able to expand so that they're doing more of the work, as it stands right now, there's just a massive deficit.
Thank you, Ann. I see your hand, Helen.
Yes, this is just going to be quick. I'd also be happy to help with getting youth voice, as well as maybe speaking with schools. I'm thinking as well of we have a couple offices within the school district that specifically deal with like mental health, mental crises, and also like youth safety within the institutions of schools. So I'm thinking about some of the adults in the network that's there. And also the school district's community engagement office has existing relationships with a lot of the groups that I think would work with you guys. So I'd be happy to leverage, especially our full service community schools network with a lot of the different orgs, whether that's BACR, La Familia, there's a lot of different work going on. And then my second point was going to be, I would love if we could get the survey sent to us. even if we're not in the working group, just because I think surveys and the questions that are selected you get such different results based on even like wording. So I'm a big believer in like getting lots of eyes on surveys.
Yeah.
So,
Good.
Thank you, Helen. Luis, you're next.
Yeah, just quickly wanted to, I guess, ditto what Helen mentioned. I also work in schools in the school district here. I'll make myself available to help connect with students and families. And I can also email you maybe the names and contact info for some Latino faith-based organizations. I don't have a direct connection to any, but I am happy to help with outreach if necessary. Thank you.
It's necessary, so thank you in advance.
Joey, Joey, I see your hand.
Yeah, so couple things raised a couple more questions for me, and I apologize. So David, you mentioned cahoots, and it's my understanding that cahoots is like crisis intervention, substance abuse, nonviolent substance abuse intervention or assistance. Is that what this program is about? Because you had me a little confused at the beginning when you're talking about trying to get away from non-traditional police and fire calls. I forget exactly how you described it when I asked about the end goal, but is this what we're talking about?
Yes, it's about, as Ann just mentioned, the percentage of calls that do not require a sworn officer to show up. And we met last week with Chief French, and she expressed a desire for support in this area because they have just a number of calls that get categorized as wellness checks, noise complaints, public, some form of public behavior that people might not find appropriate. Different things.
What, are you talking like mental health crisis or?
Yes, mental health, but please do not view this as just a mental health response. Everyone wants to immediately go to the folks who are, exhibiting some behavior that could potentially result in institutionalization or something like that. No, this is much broader. Probably, 30 to 40% of the calls that these responders will go to will not be mental health. When we did our sit along with dispatch in Antioch, one of the things they talked about quite a bit were noise calls for noise complaints, and also wellness checks. Last night, as LaShonda said, I think it was more like 11:45, LaShonda, and I was on till the very end. I listened to your chief of police give a report that gave data that showed that both violent crime and, for the most part, property crime over the last several years statistically had gone down. Now, some people question those numbers because of the now the new automated, I guess, what did they call it? The automated reporting
Incident
system.
reporting system.
Yes. But the fact of the matter is that that police are dealing with their issues of needing more manpower. That's their perspective. And they're also dealing with the reality of of having to respond to, you know, different trends in the way crime happens. But underneath all of that is the fact that they're doing some jobs that they feel that they should not be doing. And it's the same thing that we put on teachers in schools. It's the same thing, you know, that we expect from other people who are going well beyond their mandate. And we want a more humane response where people are not, you know, mistakenly being killed or intentionally being killed. And we want a response that also helps achieve public safety, where the police are able to focus on what they should be. So our goal is to present to you a program design that addresses these types of calls, which are inefficient and ineffective for police to respond to. And furthermore, if we can at the same time, or even more importantly, build a capacity in communities to respond to conflicts and situations before the police gets resolved, then that will be a better outcome for everyone.
Okay.
Thank you, David. Before we, Joey, one, your hand is not up. Two, I want to make the point, hold on. I want to make the point that we're now at 10 to 7 and we still have to hear presentations from Matrix Consulting and SOS who are here. And we have not yet had public comments on this item. So I'm going to ask people to please be really brief in their comments, especially if you've already spoken, to make your questions direct and to reduce editorializing. Thank you.
I have two quick questions.
I'm sorry, but Steve Bischoff is ahead of you. He's had his hand up for a while.
Didn't I have the floor, Deborah? So I ask
Just
one
now.
question and I get knocked off?
You asked several questions. And so I just want, Steve, how much more do you have to say, Joey? Because I really do want to
I have
recognize
two questions and they should be able to get two quick responses.
Okay, please go ahead.
Thank you. So from the conception to the implementation and the operation in Oakland and Cambridge, David, how much time are we talking about? And in your estimation, for what you know so far in Richmond, what kind of money are we looking to put into this program?
I can't answer the second. I can tell you that now. I can answer, well, in the second, we proposed a pilot for Oakland that would not be a 24/7, 7-day-a-week pilot. That would start in one part of the city. And it was for 2 teams, I believe. And it was roughly around $1.2 million. But I can't answer that for Richmond. And I'll defer to Ann in terms of the time it took, because I might be off by a month or two. In Oakland, it was approved by the council in June of 2021 or June of 2020. And
okay, and go ahead.
Yeah, I was going to just quickly say for timeline, we also can put that on our website. We can get back to the group to make sure we have the accurate time frame, and so we don't take up too much
I think
time.
LaShonda, that Joey is asking how much time does he estimate it will take to have the program up and running? Is that an appropriate interpretation?
Yeah, based on what they've already gotten completed in Oakland and Cambridge, what's the approximate timeline?
Let me just say there are two examples, Oakland and Antioch.
Could you just give that in months, please? Just in a range of time, please, just for purposes of
Oakland approved their funds in June of 2020. Implementation began in March of 2022. And that was with it being in the government. Antioch approved their program in December of 2022. I'm sorry, December of 2021, and selected a vendor because they did not put it in the city, a nonprofit vendor. It was around August of 2022. So it was 8 months in the contracting process in Antioch, and it was roughly a year.
In 9
Well,
months,
roughly, yeah.
a year and 9 months in Oakland.
Mhm.
Okay, thank you.
Okay, fine. Steve, please.
Okay, thanks. Yeah, I think one of the things I'll make sure to send to Stephanie and Guadalupe references the way you can reach information on the macro program, because there's a ton of information on the city website there. It gets into detail about what kind of things they respond to, how many calls they respond to, who they deal with, blah, blah, blah. And I think you'll find it very interesting.
Thank you, Steve. Anne, is your hand still up?
It is, and I'm gonna
Okay, go
talk
ahead.
really quickly. In terms of looking at mental health calls, the things that you and I walking down the street look at a situation and say this is mental health involved isn't necessarily the way a call is classified, right? So a person walking down the middle of the street yelling with no shoes on, you think as a mental health call, and the problem is that it's classified as a traffic interruption, right? So, almost everybody, the day that 911 is called on you or you call 911, you're having a bad day, right? This isn't, so when we try to avoid just referring to things as mental health, it's to try to avoid getting things too narrow versus the much broader range of low-level calls. In terms of the timing, I will tell you that I'm very, very optimistic in Richmond. Some of the delays that have happened in other cities happened because there were not people pushing to get things to continue to move, right? I will say that across the board, every jurisdiction that I've seen. And I think that Richmond really does have some momentum and some real conviction about wanting to keep it moving and not letting things get, kind of delayed unnecessarily due to some other considerations. So I think that that's the most optimistic thing that I could say about Richmond in terms of the timing. But in other cities, things have been delayed in ways that was not completely necessary. And we will have recommendations in terms of the different selections and some of the things that can be done to ensure that they, that there are not unnecessary delays.
Thank you. Does anybody else on the task force have any questions? Because if not, I'd like to move to public comments on this item.
All right, so I don't see any more hands from task force members. For the community, if you have a public comment, you will have 2 minutes. Please use your raise hand feature at the bottom of your screen or press *9 on your phone and we will call on you. Okay, I do not see any public speakers. So if the action was just to receive a report, there's no formal action this body needs to take, and staff will be in touch on next steps as we already outlined. So thank you, and that concludes our presentation. If you have any comments, questions, feel free to send them to staff. And we will get
Thank you so much, David and Anne. And I was with you all last night on that interminable call, and then they never got to you. So I want to apologize again for that. And I know you're going to have to come back again. And I think if it's not earlier on the agenda, maybe we can help move it up a little bit. But
it was very interesting last night's discussion, so it was very good to be there. Thank you.
Well, thanks again. It's good to see both of you. And you're welcome to stay if you want to. but you don't have to. And thanks again. And our next item is to receive a presentation from Matrix Consulting regarding the study of emergency services in Richmond. And LaShonda, again, I'll let you introduce the folks from Matrix and talk a little bit about what's happening and what this is about. Thank you.
Thank you, Chair Small. I will quickly turn it over to Richard Brady and Robert Finn from Matrix Consulting, and I will take down questions, comments on behalf of Human Resources, who is the staff that is spearheading and working on this with Matrix Consulting from a city staff personnel perspective. So with that, Richard and Robert, thank you.
Thank you very much, LaShonda, and thank you, Chairperson Smalls and the other members of the task force. This has been a long process, and it's finally getting close to something that we can present to you. I know we've had some restraints the last couple of months when trying to work with you, but we're at a point now where we can talk about some of the findings and conclusions and preliminary recommendations we're coming up with. So I've got a slide deck that I'd like to present to you. I think I've been disabled. I need to be enabled.
Okay, you could go ahead now.
Okay, thank you. Okay, so some of the setup discussion we have presented before to the task force. So forgive me if I rush through some of the preparatory things in the interest of how little time I think we have here tonight. But just since it's been such a long period of time since we've met, just quickly remind you that what we've been asked to do is to look at police and fire workloads and the service delivery system and look at ways of maximizing the efficiency of existing personnel and to develop analyses with options of the number of personnel needed to provide the wide variety of public safety services, police, fire, and emergency communications. And doing that not by looking at officers per 1,000 or fire stations per square mile or anything like that, but using a fact-driven process. So a fact-based process, but also including community input in the development of this analysis. Throughout the process, and we started this project in the summer, extensive input from the police and fire departments through interviews. I don't know the exact number, but it's certainly all the management and most of the supervisory staff and some of the line staff as well. We received community input through some individual interviews, as well as 7 focus group meetings. One of the meetings we had with you counted with as that. We met with you for well over an hour to get input on the study toward the beginning. Extensive data collection and workloads and service levels. You'll see when you get the report that it is indeed a very fact-based analysis looking at how services are delivered and looking at efficiency options and benchmarks and converting that to appropriate staffing levels for every function within the public safety services that you receive. We looked at a wide variety of options, including redeployment of staff, looking at civilianization, and dovetailing, I think, very well with the presentation you had, looking at alternative response in a number of ways. Both with this group as well as with the city and the departments, we have collaborated on where we were at each step of the process. Just quickly, I know we've talked about it before, some of the themes that came through the community input that we received is that the community noticed the budget reductions, particularly in police, have greatly impacted services. Many people feel that safety is a significant issue in the city, and that perception of safety varied considerably depending on which, for example, neighborhood groups that we were talking with. There were lots of concerns about servicing marginalized people, the unhoused population, people in various forms of crises, et cetera, and concern about disparate treatment, especially by police, something that we talked about quite a bit. There's a lot of concern that law enforcement particularly needs to be more accountable for their actions. and that they need to use data better in order to provide services as best as possible with the limited resources that they have. Many felt that response priorities were inconsistent. A variety of factors, including the area of the city and even the segment of the community that was requesting the service, that responses to similar calls could vary significantly, leading up to even non-response to certain kinds of calls. Many participants, I'd say we talked a lot about this, most participants would like to see more engagement with the community. And I think there was some understanding that this was more challenging during COVID, but now that we are emerging from the worst part of COVID, I'll put it that way, that this should be more possible now and into the future. Overall conclusions, and I'll get into some of the specifics in the next few slides, but the police department has experienced reductions, and those reductions have greatly impacted service delivery in a number of ways that we'll describe. Certainly in some of the ways that the public sees visibly the reduction in ability to work proactively with the community and increases in things like response times. Both departments have had significant numbers of vacant positions, which impacts service delivery even more. This is a national problem, especially in law enforcement, I'll point out, but the number of vacant positions in the police department, particularly in Richmond, but also in fire, have had great impacts on not just things like overtime, where there's mandatory overtime, but the ability to have any time to be proactive in a positive way with the community. I think that particularly in law enforcement, that these factors have greatly impacted management's ability to meet basic public safety needs. It has impacted their time. Many of them are doing line duty things in order to fill important functions that need to be fulfilled on a day-to-day basis. And literally, the options have been reduced for them. I think particularly in police, which provides more diverse sets of services to combat crime and perceptions of safety, that in many ways they are down to the basics of patrol and investigations, and even those are restricted. But any kind of proactive units working with the community have been eliminated or sharply reduced. So as a result, it greatly impacts the police department's ability to partner with the community, and with fire, it impacts their effectiveness to respond on larger incidents. I'm going to talk mostly about patrol here, and I'm going to talk a little bit more about the concept of proactivity. Law enforcement today is viewed to be effective when they are appropriately balancing reactive time, which is responding to calls for service, with proactive time, which is positively engaging with the community to deal with their perception and experience with problems in their community and part of the community, and using time in a way to solve problems in partnership with them. We believe that the concept of proactivity is central to an effective law enforcement agency today. And we have worked with the hundreds of police departments we've worked with around the country with targeting at least 40% of their time on an overall basis, but especially during daylight and early evening hours, to be proactive, provides that balance that is needed. Just a little bit about the workload. This graph represents all of the reactive workload that the police department responds to. It's about 47,000 calls for service. That's down a little bit compared to pre-COVID. I think what's interesting here is that while this is a fairly typical kind of heat map in time and day that shows that calls get more numerous during the late morning and afternoon and into the evening, that is less pronounced in Richmond than we expected and most of our clients, but it does increase quite a bit by a factor of 3 or 4 compared to the overnight hours. When we looked at the type of calls, this graph shows the top 10 kinds of requests for service that the police department responds to. I think what's important to take away from this graph is that while only a couple of them are overtly crimes, number, I think it's 8 there, is motor vehicle theft, is that most of the rest of these relate to not just quality of life in a non-safety context, but quality of life in a safety context, relating to public disturbances, alarms, loud music, suspicious persons or vehicles in the neighborhood, those types of things. I'm using that, we use their classifications here. Some of these, and these came out of the computer dispatch system. Some of these, like mental patients, are not a term that we would use, but that's how it was recorded in the computer-aided dispatch system when it was called in. So you can see too, like in the previous graph, that these top 10 calls all happen, or mostly happen, in that sort of very late morning into early to mid-evening hours. This is a graph, I think one of the most important graphs in the report. It shows proactivity by day in the vertical columns, by segments of time, 4-hour time blocks in the rows, going in the entire 24 hours of the day. So remember a few minutes ago, I said that in order to be effective, that law enforcement generally needs to have at least 40% of their time to be proactive. As you can see, on a 24/7 basis, the number in the lower right-hand corner here, that at 30%, that doesn't seem so bad at all. It's below the target, but we work with clients that are much more significantly below that targeted level. However, most of that time occurs during hours of the day and night in which there's not many proactive things that you can do, because most of the community is asleep and their people aren't driving around. And so while there are proactive things to do to make sure that businesses aren't being broken in, being in areas and residential areas, especially multi-housing kinds of areas where car thefts or catalytic converter thefts or other kind of things happen, they can do those types of things. But clearly, between 10 o'clock in the morning and 10 o'clock in the evening, as you can see from this graph, there is essentially no proactive time. Many hours are minus, which means that the calls are just being stacked to be dealt with by later hours of the day or evening. So the average during those hours of the day is way under 20%, probably in about 12 to 15% overall, which means there's no proactive time. It doesn't exist in any reasonable chunk of time that officers can work in any sense with the community in a proactive way. So vacancies has only made this worse. So we looked at whether there are opportunities to redeploy staff to make this better, and we have some recommendations about start times and reallocating staff among teams and by days a week. You can impact it a little bit, but not enough to significantly change that graph. As you can see, the number of vacancies within the department has been at a crisis level in the last year. 20% of the positions has been vacant. The average over the last 4 years has been about 15%. I mean, when you think about what, quote, normal vacancies are in a 20-year career, that would be about 5% a year. Most agencies we're working with are higher than that now, but at 15 to 20% or more. It's really very high level. And I should mention that the department is taking steps to remedy that, making more efforts to recruit locally and to get work harder to get laterals who could fit into the Richmond service environment. So I think before I talk about alternative response, I just want to get across that there is a significant gap in your ability to provide a reasonable level of service that can only be filled by adding resources, because you can't reduce significantly the number of calls. However, there are alternative ways of handling workloads, including alternative response. Now, if you look at response being a wide spectrum of things that you can do, from no response or telephone or internet kind of reporting, and at the other end, having a sworn officer respond to either immediately or on a delayed basis, there are lots of things in the middle that many communities have much experience over the last few years, decades even for some agencies, in responding either to lower priority, low risk kinds of calls for service, many of them quality of life types of things, many of them non-crimes, many of them are very cold kind of property crimes. Usually they're completed and you can have a civilian respond to them. They're civilian paraprofessionals. They're trained, not trained as much as highly as a law enforcement officer. They don't need proactive time, but there are ways of handling that. That has a consequence of freeing up officers and increasing their proactive time. And the other one is crisis responses, which the presentation you just had from Urban Strategies helped illustrate. And we've looked at the consequences of that in a feasibility assessment for Richmond. So it's a more effective way of dealing with people in crisis situations, including many of the unfortunate outcomes that happen in many calls in many communities across the country of unnecessary deaths associated with responses that have gone poorly because they're responded to in a law enforcement situation and focus, rather than a supportive environment and a case management kind of environment, but also just handling lower priority calls for service. So to illustrate what we're talking about here, if you look at this top graph here, the traditional way of handling it is you look at all the different kinds of calls on the left there, and on the right, is having sworn officers respond. But if you look at a comprehensive program of diverting calls for service to different kinds of service providers as appropriate, you take all those same kinds of calls and you can handle them differently, either outside of law enforcement with mental health and social services or the fire department, the phone reporting, online reporting, and civilian response. And it narrows quite a bit the number of calls that need a sworn response of some kind. We looked in some depth at divertible calls for identified situations involving assist to citizens or assist to people who are homeless and people in some sort of crisis when those calls occur. And while they happen all sorts of days and times of the week, that they primarily are the kind of calls that happen again in those peak hours of late morning into the early evenings. So we have, you'll see when you see the report, have come up with a supportive analysis that says that you could start out with something like 8 community services officers to handle the lower priority calls for service. And with that, you'd be able to divert 12 or 13% of the calls. Many communities, Fremont in the Bay Area and Mountain View also in the Bay Area, and the other side of the Bay, they are able to divert 20 to 30% of the calls. But to do something between 10, 15, 20% is something that should be very doable. And the report identifies the number of calls that could be handled in that way, how they could be handled, how you'd work in dispatch to identify them. On the alternative response as it relates to crisis calls, we have a supportive recommendation in there to have 2 teams that are outside of law enforcement that have a mental health technician paired with an EMT to respond. Sometimes that would be a co-response with police, depending on the nature of the call, but to work with people who, in a more case management way, to get them into programs and services, and to work with them more of a longitudinal kind of way, just dealing with, rather than dealing with it in 5 minutes or 30 minutes or something like that, in a more productive way. So there are other opportunities that we've looked at, including using civilians in different capacities within the police department and adding to that. You currently have crime analysis, but yeah, we think you need more of that. Those would be civilians. Department is starting a process to hiring civilian crime scene technicians, and more of that can happen. As in police officers, in emergency communications, it really is in crisis proportions across the country. It's not any different in Richmond. Right now, the number of vacant positions are so great that it's not just excessive overtime, but mandatory overtime, and that's just not sustainable in the long term. This study was not just about the mechanics of looking at staffing. We also looked at recruitment and especially training to make sure that the Richmond Police Department had what we're calling a community-centric plan that supports this proactive stance that we're talking about. And they also need to increase the amount of training that they receive, as well as having it more holistic. So I am going to turn it over to Robert, and he's got a couple slides here to talk about fire. Robert?
Thanks, Rich. So when we were evaluating the fire department, there's really three important factors when you're looking at the performance. Two of which are what you would call controllable. So that's the call processing, how quickly dispatch processes the call and notifies the fire department. Then there's the turnout time, how quickly they, from the time they're notified until their units are en route. And then the third is the travel time, which is shown on this slide. And the travel time is the time from when they go en route to the emergency to when they arrive on the scene. National best practices. There's a document from the National Fire Protection Association, NFPA 1710. They have set the benchmark performance, so gold standard, if you will, at 4 minutes travel time, 90% of the time. Most communities cannot meet this standard. Most communities choose not to meet it. So it's important then that the community adopt performance standards for what's acceptable to them. You can see over the 3 years of data we analyzed that your travel times right now are at 6 minutes, 44 seconds, 90% of the time. It's also important to note that the call processing and turnout times are longer than best practices as well. And those, when they begin to get measured and reported, you should be able to improve those. But really the only way to change travel times is by improving your automatic aid, changing how you deploy your resources, or increasing the number of fire stations. So that's what drives your travel time issues, is the way your city is configured. And it's really hard to locate stations. And there are just some areas that will have longer travel times based on the layout of your community. One of the largest issues we saw, much like police, was the amount of overtime being needed in the fire department to meet the minimum staffing. So for example, a fire engine may have 4 people scheduled, but the minimum for it to be able to respond and be effective is 3 people on the fire engine at a time. So just to meet your minimum staffing needs last year, there were over 54,000 hours of overtime. The 2 biggest drivers of that are, one, the vacancies. There are currently 14 vacancies in the fire department. And then the second largest driver is workman's comp and people on long-term leave due to workman's comp. So when firefighters are forced to work a lot of overtime shifts, then there's fatigue. That fatigue leads to accidents on the fire ground. Those accidents lead to workman's comp, and then you kind of perpetuate the issue. So really getting those vacant positions filled, which HR has put in a number of initiatives since December to do that. and as well as getting better back to work policies to reduce the length of time people are on workers' comp are two critical themes that we saw for improving the fire department staffing and response reliability. So when you look at the performance of the fire department, it's important to know that you've got a number of automatic and mutual aid partners. And this map, and there's several in the report that illustrate various response capabilities of the fire department. But you can see with your mutual aid partners, a majority of the city can be covered within 5 minutes and 20 seconds. So improving the timely notification of them, you should see some improvements to that travel time. There are areas along the coast that are not going to be able to achieve those times, as well as some of the more remote areas of the city where the call volume's low. But using the regional approach like you guys do is a best practice and something that shows how those partners help you be able to achieve a timely response to emergencies. So in the alternatives that we mentioned, like I said, return to work policies to help control the amount of overtime, putting in policies of the maximum amount of hours personnel can work. And then the other thing we put into control overtime was adding 19 shift personnel, because your relief factor, the number of people you need to effectively staff 24 hours, 7 days a week, 365 days a year, wasn't balanced with the amount of leave firefighters are allowed to take with their contract. So you needed to add staffing to reduce the overtime and help control the amount and make it a manageable for the department and improve that work-life balance for your fire personnel. And then the other critical thing, like we said, was improving that dispatch processing for dispatching units and capturing data to make sure that it's reliable and usable for the fire department. We also looked at the idea of bringing in cross-staff quick response EMS vehicles. They're less expensive. They're a little quicker to respond to the EMS calls, which is the largest call type your fire department faces. And they're easier to obtain than the current apparatus right now. A fire engine can go anywhere from 780,000 to close to $1 million. And there's about a 3-year delay in delivery. So these vehicles are easier to get, they're cheaper, and it'll reduce the wear and tear and need to replace those very expensive large apparatus. The first real alternative for us for the fire department was filling the vacant positions, and then it moved into more looking at getting some of those civilian positions. So fire adaptive community coordinator for the wildland urban interface areas, a public education coordinator to help with the workload, and then an extra fire inspector.
So where we go from here. So we have reviewed on a first draft basis the draft report with the police and fire departments, and we have given them a revised draft. And so we haven't completely reviewed the report yet. And I'm glad, though, we were able to get to you with at least what we've been able to provide you tonight. But I think that process will take us through February, most likely. So finalizing the report sometime through March and presenting the report to the city in the March or April timeframe. These are my guesses. There's no official time frame, but as you can appreciate from the last few months, things sometimes move slowly. So we're doing our best. So with that, what concludes our presentation, I'll stop the share and answer your questions.
Thank you so much, Richard. I really appreciate it. I want to note that it is now 7:26 and we still have not taken questions from the task force or the public, but our meeting is due to end at 7:30. So I would like to entertain a motion to extend the meeting to complete this item. Completion being the questions from task force members and any public comments on this item.
So moved.
Who is that, you, Don?
Yes.
Can I have a second?
I second.
Thank you, Don. Thank you, BK. Let's take a roll call vote, please, on that motion.
Helen Burks,
No.
Steve Bischoff,
Yes.
right? Marisol Cantu left me, exited the meeting at 7. Eddie Chacon also left the meeting at 6:46. Luis Chacon,
No.
Don Gosney,
Yes.
Randy Joseph. Randy Joseph.
Then he had to go too.
You left too. I apologize. Kristen Killian Lobos,
Do we still have a quorum?
barely. You're right at 11.
Okay.
Yes.
Armand Lee,
Because I'm surviving off 3 hours of sleep in a travel day, I'm going to have to say no.
okay. Laura Mangles. I think, sorry, I think she was here, right? No, she was absent. Marcus Endesang,
No.
Joey Schlemmer.
No.
All right, Deborah Small.
Yes.
Ontario is not here. Tamisha Walker.
No.
Right, Linda Whitmore is absent. BK Williams.
Yes.
All right, let me get this. So we have 5 ayes, 6 noes, and 6 absent. I don't believe that motion is approved.
Okie dokie. So then that means our meeting is now adjourned.
Good night, everybody.